Hello, and welcome to our first installment in our series of health-related informational videos. I'm Dr. Marcus Reeves, Chairman of the Committee for Health-Related Affairs and Initiatives for the Mississippi State Organization of Omega Psi Phi. In recognition of Heart Health Awareness Month, our state organization is endeavoring to bring its members information on general cardiovascular health. We're doing this through an initiative called Q's Give a Heart. During this program, you will hear from several brothers who themselves, their family members, loved ones, or friends have been affected by cardiovascular disease. We want to first begin by giving you a few statistics. Cardiovascular disease is the leading cause of death globally. It's an estimated 18 million people died in 2019 from cardiovascular disease alone. That represents about 32% of all deaths globally. Over 3/4 of cardiovascular deaths occur in low and middle income countries. And this is mostly due to lack of care or low access to care. It is important to detect cardiovascular disease early as possible so that management can begin as soon as possible. Now, what are cardiovascular diseases? Cardiovascular diseases are a group of disorders of the heart and blood vessels. They include coronary artery disease, when you're talking about the heart, cerebral vascular disease, when you're talking about the brain, peripheral artery disease, when you're talking about the blood vessels of the arteries of the limbs, congenital heart disease, which involves birth defects that affect normal development and functioning of the heart, and rheumatic heart disease, which is damage to the heart muscle and valves due to a bacteria. What are some of the cardiovascular risk factors? The most important risk factors for heart disease and stroke are unhealthy diet, physical inactivity, tobacco use, and heavy alcohol use. The effects of these risk factors may manifest themselves as certain disorders that are well known to most of us. These include raised blood pressure, which is called hypertension, raised blood glucose or sugar, which is called diabetes, raised lipids, which is called high cholesterol, and being overweight/obesity. These risk factors can be measured by healthcare providers and appropriately managed if the person is seen and treated in time. What are some of the symptoms of cardiovascular disease? Well, some of the symptoms, if it involves the heart, include chest pain. You can have discomfort in your arms, shoulders, neck, and even your jaw. You can also experience shortness of breath, nausea, vomiting, faintness, or even break out into a cold sweat, which is what we call diaphoresis. If it involves your brain, you could have symptoms such as numbness of the face, loss of use of one side of the body, confusion, difficulty speaking, even difficulty walking with loss of balance. You could also have severe headaches or even unconsciousness. Now, we understand that this short discussion does not give us enough time to give you a detailed information regarding cardiovascular disease. It is our hope, however, that this information is found informative so that you may want to go and pursue other information regarding this topic. I always tell my patients the first place to go is to your healthcare provider. They offer you the best information regarding your health and your particular condition. A list of credible websites have also been provided, which can give you detailed information regarding this topic. Now, if you have any questions, comments, or would like to see other topics presented, please contact me or the Office of the State of Mississippi, Omega Psi Phi, and more information can be provided. Remember, your health is essential. Thank you for listening.